Hey guys, welcome back to another video. I'm Dr. Jesse McClung, and today I'm going to tell you a little bit about one of our imaging machines we use. So this is a CBCT, or cone beam computed tomography, which is a device that has an X-ray unit that moves around your head. It takes several hundred different individual X-rays, and then the computer computes that, puts that all together, and creates a three-dimensional image. This is a wonderful device. It allows us to see things going on in the jaw better, with better definition. We can catch things earlier than some traditional X-rays like a pantograph would. It's also very low radiation. It's a very low radiation amount. And this is specific to the machine we use. I can't speak for every machine, but our machine is very, very low dosage. About 30 microsieverts for a scan. And to put that into context, that's the equivalent of a few days of just normal background radiation that you would get just by living on planet Earth. It's the equivalent to about one flight from New York to Los Angeles, so a very small amount of radiation. But with this, we will then have a three-dimensional picture of the teeth, of certain jaw structures, of everything that's kind of going on in this area. And we can look at it from behind, from the side, from the front. We can just see things a lot better. So we'll use this device on almost all new patients, or an existing patient who might be having sort of a problematic area. We can take a look using this device. And then about once every 5 years, we'll take a new scan. Again, just to make sure that there's nothing growing in the jaw or nothing developing in there that shouldn't be there, that you may not be feeling or may not have pain from. So it's a really good diagnostic tool to help us make sure everything is nice and healthy in this area. So I'll show you a quick example of the machine, and then I'll show you some of the images that it takes. So here we have an actual CBCT image being taken. This is on one of our team members who needed an image, and she was kind enough to let us film it. And once this is completed and the software processes it, we get an image that looks like this. So this is a 3D rendering of the scan. And it's important to note, we don't really use this particular image for diagnostics, but it is helpful as a visual aid for showing folks things. But over here, you can see a couple other screens, and we can look at a tooth. This one shows us kind of a side view of a tooth. This shows me a top-down view of the tooth. And this one over here shows me a front to back view of the tooth. And we're able to scroll through, look at things, different points, different angles. We can literally look from behind the tooth forward in basically any direction. And we're just able to see things in the jawbone, in the teeth, even in some soft tissue things. We can look for airway issues, potential risks for sleep apnea, issues in the sinus. This is the sinus up here. So we're just really able to see and scan for a lot, and all, again, with a very low dose of radiation. So a pretty cool device that's really helped us keep people healthier and catch things much earlier than we used to be able to.